One Democratic senator may be winning over a number of skeptical Republicans. More important than that, he may, in fact, be putting the patient in a stronger position to deal with their own care, as opposed to the insurer/employer/government. So I'm referring to Senator Ron Wyden. He's a Democrat from Oregon. Oregon already has been one of the most innovative states in dealing with health care. They've addressed things like rationing, et cetera. Contessa has the details on Wyden's ideas. What's going on?
Dylan, here's what the senator is proposing. He's calling his plan the free choice proposal. So it creates an insurance exchange for people to find insurance. It would let employees pick their own plan, and businesses would then provide vouchers to their employees to help them pay for it. Insurance companies would not be allowed then to cherry pick only healthy customers. Under Wyden's plan, every person would have to be enrolled. The Lewin Group, which is an independent consulting firm, has estimated that Wyden's plan would actually reduce overall national spending on health care by $1.5 trillion over the next 10 years. That would equal right now what the House Democrats' plan would cost over the next 10 years.
And joining us now, Senator Wyden. Senator, where do you stand in advancing this conversation? Where do you find you get the most resistance when you try to advance it?
I think that Americans want choice, Dylan, and they're going to wake up pretty soon and find out that under these proposals up here on the Hill, most Americans are not going to get choice.
No, I agree with you.
Just some people to get it. Everybody ought to get it.
What's interesting to me, Senator, is where you run into resistance. In other words, if your idea is to try to put patients in a stronger position to deal with their own health care and create more competition in insurance, all the things that you're discussing, why and where is the resistance to advancing that conversation? Why is there a resistance to a conversation that, again, takes healthcare responsibility away from the employer, away from the government, and puts it with me? And if my mother would have her say, I'm sure she would like to be in charge still. But why is there resistance to your efforts to put patients in a firmer footing for their own health care?
Unfortunately, there is still a pretty strong status quo caucus in this country. You have, for example, the insurance companies. This is going to create a lot more competition. This is going to force the private insurance companies to compete for people's business. Not only is it going to be illegal to cherry pick, but for the first time, consumers are going to have some real bargaining power. By the way, the employer will have more bargaining power, too, when the employer has to negotiate with the insurers.
If you were to look at the Republican resistance, when the Republicans say we don't want to do this, it's going to cost too much, is that them simply taking lobbying money from the health insurance companies? Are they bought by the health insurance companies to basically kill anything that diminishes the profitability of health insurance companies? And why are our politicians so beholden to try to protect the profitability of health insurance companies, even when it comes at the expense of the health care of everybody else? I look at the health insurance companies as the Allen Houston deal in my New York Knicks analogy for American healthcare. We're blowing a lot of money and getting very little out of them.
Certainly there are some Republicans who more than anything just want to defeat reform. They want the president, for example, to get a big defeat. But we've got a lot of Republicans that are prepared to change this inhumane model of the way insurance is priced. Today it's all about cherry picking, just finding the healthy people, sending the sick people over to government programs more fragile
insurance
than they are.
only works.
We've got Republicans, Dylan, who are prepared to support real insurance reform.
Senator, can I ask you a question? I kind of wonder if this is actually a moral issue for America, because we tell pollsters we want universal health care, but then we don't want to pay for people who can't afford it in the current uninsurable. So we're kind of going both ways there. We want everybody to have health care.
But my point and his point is that whole conversation is nonsense. In other words, all or nothing back, which is the Hatfield-McCoy conversation, which is the conversation everybody's been educated to have, is part of the problem. In other words, we need to stop having the Hatfield-McCoy universal, no universal, and start having the conversation that is, why are we pumping piles of money into health insurance companies and depriving people of health care when we could put people, as the senator suggests, in charge of their own health care and then use competitive force to drive that fat profit margin that is that cancerous boil on the side of our society that is health insurance. That's sucking money out and depriving people. We could just inject competition into that little boil and it dissipates. And that's why I like the Wyden plan as much as I do. I'm curious, Senator, what resistance you have found. In other words, what are the next steps for you if you try to advance a personal choice type of a model?
Certainly we're going to face strong opposition, as you've suggested, from insurers. Some say, Dylan, that this is blowing up the employer-based healthcare system. I don't think that's the case at all. I think there is a sweet spot in between blowing up the employer-based system and saying you're not going to try to improve things at all for the consumer. We've outlined on this show how the real target are these abusive insurance company practices. This plays hardball with the insurers. This ensures that everybody has the opportunity to have real leverage with the insurance company so they can get a good deal.
Other than the insurance companies, which would be the obvious resistance, and I would argue that because their resistance is so obvious, I think they'll actually have a hard time because it's basically the insurance companies against everybody else. If you can get beyond that, where else do you run into resistance in an effort to, again, be honest about the fact that people change jobs 11 times before they're 40 years old, that the employer-based health care plan was predicated on a model where people stayed where they were, and now we have young people in this country, creative people that want to go out and do things but are afraid to leave horrible jobs purely because they don't want to not have health care. It's crazy.
Dylan, the other big problem is that the president has correctly said that you can keep the coverage you have. But unfortunately, the way these bills are written on Capitol Hill, you can't reject the coverage you have if you don't like it and go get something better. So what I want to do is make sure that everybody, not just some people, have these kinds of choices to get a better deal for themselves and their family. If they can save $1,000 on the insurance exchange and get a better policy in terms of prevention, my plan would let them do it. These bills on Capitol Hill mean for millions of people, their premiums are not going to go down and they aren't going to get choices like members of Congress have.
Exactly. And you have an idea that allows everybody to make choices and forces the health insurance companies to deal with honest competition and provides potential care to everybody as opposed to 3/4 of the people or 2/3 of the people or whatever. We've got Senator, thank you for the time. We support your cause. Please come back. We'll talk to you soon. Senator Ron Wyden out of Oregon.